In the last section, Dr. P, you talked about maintaining normal rhythm. Now let's switch gears and talk about rate control.
Okay, Lindsay, we'll do. So the concept of rate control means you allow the patient to stay in atrial fib, but you want to make sure that their heart rates just don't go too fast. Rate control can be a primary therapy. That is, no attempt to keep the patient in normal rhythm is made. Or it can be part of an overall strategy. Some people do get occasional episodes even though you're trying to keep them in sinus, so when they do go out of rhythm, you really don't want them going really fast and have a lot of symptoms. So when you look at this, I find it very difficult for patients to understand the difference of these drugs. Often people will come to me saying, I've been given 3 drugs, Dr. P, and nothing works, and what am I going to do? And you find out all they've been given are drugs to control the rate. So what I hope to do with this figure is to give you a concept of rate control using an analogy that you could see in the kitchen when you use a strainer. And if you take a look, the AFib impulses are represented as the water coming down that meets the strainer. Now, the strainer, for the purposes of this figure, represents the conduction system we've talked about earlier, the AV node. How much water comes through will depend on how many holes are available in the strainer. In the heart, obviously, it's how many impulses will get through, okay? So what you want to do with rate control is you want to slow how much impulses get to the bottom, or in this figure, you want to slow how much water, right? Decrease the water coming through. Now, to do this, what I've done is put a bunch of corks in some of the holes. And now you can see in this figure that the less water gets through. Now, obviously, you don't put corks in the heart, right? So, but we use certain drugs that are like corks. They can slow the conduction down, and they're not the same drugs we use when we try to keep normal rhythm. These are drugs such as diltiazem, certain kinds of beta blockers, verapamil, and digitalis. They're the corks in the heart. They don't prevent atrial fib, but they'll slow the rate, maintain a much more stable effect for the patient.
It certainly helps to have that visual. Do you have a video example of what this looks like?
Yes, I do. So here we have a video that shows you a patient in atrial fibrillation. Notice again, as you've seen before, the heart's in the top chamber beating very fast. And initially, you have a lot of rapid impulses coming down to the bottom. And your heart rate's fast. Patients might feel a sense of palpitations, shortness of breath, just not feeling well, right? So what you want to do now is give one of these rate controlling drugs that we've talked about. And when you use those rate controlling drugs, notice that while the atrial fibrillation continues, less impulses get to the bottom, the rate slows, and the patient becomes more comfortable.
Can you give us an example of how this would look in a patient?
Sure. This is actually one of my patients, no patient name on there, of course, that we looked at a 24-hour rhythm strip throughout the day. And let me stop here for a moment and talk about this concept. A lot of people put patients on a treadmill. They try to see what their rates are going to be. And here's my concept of that. And it's a little different, I must say, than some other folks. I like to see how one's rate is throughout the course of their normal activity during the day. So I often give patients a monitor to wear. We've seen the monitors earlier that we can use, like a Holter or something like that. And I collect their heart rates throughout the day. And then that's that person in their normal environment. If you have a person who's real sedentary, whose maybe greatest exercise during the day is walking to the refrigerator or possibly the mailbox, do you really want to control their rate when you're running on a treadmill? And then what happens is you give them a bunch of drugs to slow them down, and then you slow them down to the point that when they're at rest, they feel lousy. So what I like to do is use these printouts. And this is an example of one such patient. So as you can see, if you look at the control on the top part, before they were given a drug, many hours of the day, their heart rate is too fast. And then we give them a drug, metoprolol, which is one of the corks that I'm talking about, and we let them then go through with another monitor. And now you can see that this is a nice, much slower rate. And frankly, at that point, if they're feeling good, you've accomplished your goal.
So Dr. P, could you go over those medications one more time?
Sure. This chart shows the types of drugs that are used to control the heart rate during AFib. They are beta blockers. A few common ones are metoprolol, atenolol, but there are many available. Then there are drugs that block the calcium channel in the heart. Those are additional drugs that can slow heart rate, and that's verapamil and diltiazem, and digitalis that's not used that much anymore. And it's been my common experience that patients see me for a second or third opinion who feel very discouraged because they think they've received drugs that are supposed to keep them in normal rhythm, and in many instances it's been one of these drugs, the corks, that will control their rate but have no ability to actually keep them in normal rhythm.
Absolutely. Well, now we'll get even more specific, diving into a condition that's a bit of a mouthful, but important to understand.